Although having bad breath is a common illness that affects people of all ages, including children, it may be incredibly embarrassing to see people keep their distance from us as if we were spewing fire from our mouths. You're not alone if you occasionally have terrible breath. Studies show that 50% of adults have experienced it at some point in their life. There's several potential causes of bad breath, ranging from the innocuous to the grave. But what would you believe is the biggest factor? Hello, welcome back to Know What. In today's video, we're going to explain the causes of bad breath and how to get rid of it permanently. Watch until the end of the video to know exactly what to do when you encounter bad breath. Bacteria that produce odor in the mouth cause bad breath. Bacteria build up on food particles left in your mouth and between your teeth when you don't brush and floss on a regular basis. These bacteria produce sulfur compounds, which cause your breath to stink. In the medical community, bad breath is well known under the term halitosis. Humanity has been battling the halitosis monsters for ages and has tried many methods, including chewing on cloves, twigs, and even eggshells. Microorganisms, and more especially bacteria, are the genuine rent-free residents of your mouth and the leading reason for bad breath. Bacteria cause almost all chronic bad breath, and we can always identify and eradicate those bacteria to eliminate bad breath. Oral microflora, which are hundreds of different species of bacteria naturally present in your mouth, does not smell particularly pleasant. After you consume food, your mouth's warm, moist environment serves as the optimal growing ground for bacteria. The bacteria in your mouth feed on dead tissue cells, mucus, and food particles that have been broken down into tiny molecules in order to allow them to receive nutrition through their cell membranes, and as a result, harmful substances like hydrogen sulfide, cadaverine, and methanol are released into the air, giving you what is known as bad breath. A dry mouth is another factor in poor breath. Your saliva performs around the clock to clean your mouth, but if there isn't enough of it, your mouth won't get cleansed thoroughly. This can be brought on by a few medications, problems with your salivary glands, or even just by breathing through your mouth. Some medications might also produce bad breath. Nitrates, which are occasionally used to treat angina, chest pain caused by a restriction in the blood supply to the heart, chemotherapeutic treatment, and tranquilizers are examples of these. Periodontal disease is sometimes referred to as gum disease, and a number of people have gum disease but are unaware of it, and the bacteria that is lingering in your gums might play a significant role in the bad breath. Another significant reason for bad breath is the stuff you eat. If you eat meals with garlic or onions, those things can produce bad breath, and it will take a day or two for it to go. Did you know that a person's bad breath might give away information about their health? For instance, a person with uncontrolled diabetes may have an acetone-like breath smell. Acetone is the same chemical compound in nail polish remover. Additionally, illnesses including sinusitis, kidney, liver, and stomach infections, as well as diseases of the sinuses, can cause bad breath. The crucial question is, how do we protect ourselves against this bad odor? Keep watching, because here are the ways you can get rid of halitosis, commonly known as bad breath, permanently. Fortunately, doing nothing more than brushing your teeth at least twice a day, flossing once per day, and cleaning your tongue will easily get rid of the smelly monster. Mouthwashes can assist in eradicating bacteria, or neutralizing and temporarily masking the unpleasant compounds. But the longer you put off brushing and flossing your teeth to remove those food particles, the more likely it is that your breath will be inflammatory. Most of those microbes that cause bad breath are found on the back of the tongue. When you brush twice a day, don't forget to brush your tongue to eliminate the bad breath germs. You can also use a tongue scraper. If you stick out your tongue and look way back, you'll likely see a white or brownish coating. That is where all the bad breath-causing microorganisms are. According to one study, brushing your tongue can cut your bad breath by 70%. If you have detachable dentures, remove them at night and be sure you thoroughly clean them before putting them back in the following morning. For dry mouth, to assist in producing more saliva, you could try chewing sugar-free gum or sucking on sugar-free candies. All of these techniques demonstrate how simple it is to get rid of bad breath. Did you know that some people believe they have bad breath even though they don't? This psychological ailment is known as halitophobia. Additionally, remember to go to the dentist frequently for a checkup. Keep in mind that if your mouth is unhealthy, your body won't be as healthy as it otherwise would be. That brings us to the end of our video. I hope you enjoyed it. If so, make sure to like this video and subscribe to Know What to watch more videos like this. Comment below with your questions. We'd love to hear from you.